Hey everybody, I just want to tell you and show you what's been going on with me. Why I haven't been to work, why I haven't seen anybody. As you can see, I'm in the ICU. I am in critical condition despite what you see right now. It's pretty scary. So I just want to share this with you and how important it is to listen to your body. I'm glad that I did. This is a swan catheter, so I'm in the cardiac ICU. They're helping my heart. My heart is dying. So here is the swan catheter. It's going down through my jugular vein down into my heart, and this is how it helps keep my heart pumping and sends medication and takes blood directly from my heart. So it's pretty scary, but this is what is helping my heart contract right now, despite of how I might look. But okay, so I think it's important to share this, so I'm going to share it. About 2 weeks ago, I started getting short-winded going up the steps at my house, and then I started getting a little winded doing my relief post at work, walking from post to post. I noticed that I had to go really slow, because if I didn't go slow, I would feel dizzy and I wouldn't feel right. And then it wasn't after that I started getting strange pains, like in my stomach, not in my chest, in my stomach, and it traveled down to close to my belly button. And that's when I made an appointment with my doctor, because I was like, this doesn't sound right. So I talked to my mom about it, and she's had her gallbladder out. And I thought, okay, maybe this is a gallbladder attack. So when I went to the nurse practitioner, she said, let's go to the VA, because that's where I go, in Cincinnati, and they can take some imaging and find out exactly what the cause is, because you may be having gallbladder issues. So I get to the Cincinnati VA, I go through the emergency room so they can take these images, and before I knew it, they did EKG, ECG, found some abnormalities, and I ended up in the cardiac intensive care unit at the University of Cincinnati. So that's where I'm at right now. It's pretty scary. I've had visitors, but I can't see my kids, and that's hard. But I'm making it, and I just want to tell you guys that heart attacks and arrhythmias, things like that, they don't have to present as chest pain at all. It can be any part of your upper body that can start behaving strangely. So if you notice something's not right, go right away, because I'm sure you guys have heard all those stories of young people who collapse and die out of nowhere. That was going to be me. So now I have to have IV medications, and they're going to try to take me off of them to see if I do well. And so far I have, which is good. Means that maybe I can just take heart failure pills when I get home. So that's where I'm at currently, and if I can show you guys a picture of my heart, there's 4 chambers. There's 2 at the top, left and right atrium, at the bottom, left and right ventricle. Well, my left ventricle is pretty much dead. It's gone. So the only thing that is keeping me alive are the other 3 chambers. And that's pretty scary. So they came around and spread doom and gloom, like LVADs and heart transplants, and I was like, this isn't happening. I'm too young for this. This should not be happening. I don't want to talk about heart transplants right now. I'm 36 years old. And they said, well, we just need to prepare you for what could happen. And I said, okay, so that's worst case scenario. Best case scenario, I get to go home with meds and lead a normal life and just have to take meds all the time. Situation gets worse. I have been diagnosed with a rare heart disease. Only 5% of the population in the United States has this disease, and it's called cardiac sarcoidosis. Funny enough, it usually happens in the lungs, and it happens to African Americans, older African Americans. And look, I'm none of those things, but it happened to me. It did. And so that's part of why I'm here. It sucks, but it's a very rare disease, and they have to treat it specially. So I'm going to have to take immunosuppressants, kind of like somebody who has HIV. It's crazy. It really is. And I miss home. I miss my friends. I miss work, crazily enough. I miss all of that. But I'm hoping to be out of here soon. Things have been looking good for me. They're actually going to take that ugly thing off today, because I'm no longer dependent on the IV meds, which is fantastic. So they're weaning me off to the pills. So that means I'll get to go home soon. But today they talked to me about a pacemaker. I'm 36 years old. These things don't happen to people my age. They happen to older people. Because I have so much scar tissue from this cardiac sarcoidosis. It's not, the left side of my heart is not getting the conduction to the right side. And the only thing that is going to fix that is a pacemaker, or I could collapse like all those other people you hear about that are young and just die out of nowhere. This is why. So please, please, please listen to your body. I'm glad that I did, because that could have been me, and it could be anybody. So you never think someone so young could go through something like this, but it happens, obviously, because I'm here. So I miss you guys. I'm fine, and hopefully I'll be out of the ICU really soon.